Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. My guest today is Leticia De Lara, a member of the Desert Healthcare District and Foundation Board of Directors. She is a lifelong Coachella Valley resident who also serves on the Intercare Board and is employed as the CEO of the Regional Access Project Foundation, which many of you may know as the RAP Foundation. Director De Lara joined the board as an appointee in January 2019. She was then elected in 2020 and again in 2024 as the Zone 7 representative. During her terms, she's held the office of board president and is currently board secretary. Welcome, Director De Lara.
Thank you. Thank you for having me.
We've been wanting to do this for a while, so I'm excited to chat with you. You've mentioned in the past, and I've read, that you grew up in the Coachella Valley as part of the farm working community. So I'm wondering, when you look back at your upbringing, your childhood, what are the most significant ways that experience, those years, have shaped who you are today?
Okay, so yes, you are right that I was born into and a big family that worked in the Coachella Valley for many years. I was a farm worker myself. And that experience of growing up in a family of 12 kids and working alongside my siblings, just working to make a life. My parents were immigrants, and they recognized the need to establish a strong family, and that it was necessary for us to be migrant farm workers, so we did follow the crops. And that experience taught me that families sometimes make sacrifices, that they make sacrifices to improve their lives. Sometimes there's difficulties that you have to overcome. There's challenges that you have to face. In my circumstances, it was the fact that my parents did not have any formal education, and so they overcame it. They worked hard, and we struggled for many years trying to just find suitable housing. And one of the things that they taught us was the need to invest in the future, to work hard, to seek our education. And they made a lot of sacrifices for us. So because of those things, I never took anything for granted.
Right.
I never took the fact that I had the opportunity to go to school and further my education and get my degrees for granted. It taught me that you had to overcome difficulties, and that it was important for us to recognize the importance of our community, the resources that were available. They didn't have a lot of income, so they relied on services that were available in the community, on being able to access healthcare that was for free. And those things, I was very fortunate, and I don't take those for granted. I know that many of families today are still struggling, that they face the same challenges that my family did and that I did when I was growing up. And I understand firsthand how difficult it can be and how overwhelming it can become. But just trying to make sure that those resources that were available for my parents growing up, when I was growing up, are still available to families today.
So when I was introducing you, it was quite a long introduction because you've done so much and you're doing so much. Is it fair to say that those years also informed your work ethic?
Yes, definitely. I have learned the value of not only working hard, but working smarter.
Okay.
To be able to learn from others, to be able to work with others, being able to form valuable relationships through years of getting to know people and doing my part to improve relationships and to have people that I can count on. So my work ethic is always doing my best, always working hard, and never falling short of what others people expect from me. And I think that the work that I've done in the public service has been very rewarding. And I think it definitely doesn't feel like work now because I'm very fortunate that the positions that I have held have always made me feel like that they're not work.
Right.
That they give to me an opportunity that I would not have otherwise. But it definitely my background has definitely formed a strong work ethic.
Before we get into more of your career and including what you're doing with the district, I wanted to ask about being part of the migrant farm working community. I lived in the Valley a long time, in the Western Valley, and I'm sometimes surprised that people on the Western End don't really know much about the farm working community. What would you say is the biggest misperception about migrant farm workers in the Valley?
I think the misconception is that families do not want to get involved, that there's a hesitance to actually move beyond their conditions, their place. And that could be because many farm families like myself, we relied on each other, so we became a community amongst ourselves.
Right.
It didn't mean that we didn't want to be part of a bigger community, but when you share language, when you share families, you have the same babysitters, you go to the same schools,
Culture.
it becomes a smaller community. And I see that in our Eastern community, the families that are living there now, that many of them have the same kind of structures but it's not to say that they don't want to be part of the greater community, but it's just that there's a sense of belonging, a sense of culture. So they do tend to rely on each other. But I think that's a misconception, is that they don't want to integrate, that they don't want to be part of something else.
See.
And that's not true. I think it's just that they feel comfort, they feel the sense of belonging with one another. But they, like my family, understood the need to be part of our surrounding community as well.
And sometimes, or probably a lot of times, there are long hours involved when you're doing farm work.
That's correct. Those long hours could be in good times, when that means that there's lots of work. It could be starting very early in the pre-dawn hours and coming out until the evening, and working the weekends. And for me, when I was in school, during the holidays, working weekends. So that's what many families do. And so they have the same hours, they work together, they rest together. So there's definitely a sense of community, of going through the same experiences that other families like yourselves are going through.
So I want to talk about your career. It's really very impressive. I know prior to joining RAP as CEO and the Healthcare District Board, you worked for 2 Riverside County supervisors. You were, I believe, District Director for Supervisor John Benoit and Chief of Staff for Supervisor Roy Wilson. What is the most important thing that you learned about politics, the effectiveness of politics, being in such close proximity to 2 pretty high officials in the county?
I think I learned from both of them that it wasn't politics, it was more of public service, serving others. And I had the fortune of working first with Supervisor Wilson, who was my mentor. He taught me how to be a better listener, how to be able to bring people together and figure out difficult situations, figuring out possible solutions, looking at things at different ways, and being able to connect people to resources. So it wasn't politics, it was service.
Public service.
His favorite saying used to be that he expected his team to be bureaucracy busters, to break through the bureaucracy, to help people, to be of service to people.
I love that.
So that's what we did, and I love that. And later on for John, he brought a lot of experience working in public safety and also in the state politics, and he also recognized the need to serve the community, and he had high expectations of his team as well, to be there to be able to bring to the attention of the public officials of issues that were affecting families. So I think that's what I learned best of all, that it was about serving others.
Okay, excellent. I'm wondering, when it came to your introduction to the healthcare district, was it through the supervisor's office? How did you find out about the Desert Healthcare District?
Starting with the time that I worked for Supervisor Wilson, I was in charge of a lot of the social service issues, the people issues, what I used to refer to. So that included healthcare. So that brought me the opportunity to actually become familiar with the healthcare district, to actually attend meetings. I would be here in Palm Springs office several times, just hearing about issues that were sometimes related to the county issues and grants that were being considered, or even providing public testimony on issues. So that's how I first learned of it. And through the years, working with different leaders at the healthcare district, working sometimes in collaboration, looking for opportunities for how we could share resources or work together. And we did, I think, some good projects. Through the years, as I transitioned into the private sector or the nonprofit sector, I had a better understanding of the healthcare district, so I actually looked for ways that we could collaborate together, because there was less resources. That I felt that in my position as a CEO of the Regional Access Project Foundation, that it was necessary to, again, work smarter. How do we collaborate rather than duplicate, rather than there's never enough resources, and so we need to figure out how we can work together. And I think there was a couple of interesting projects that we actually came about because of ideas, that there was something that we talked about and that we worked together, not only with the RAP Foundation, but other nonprofit leaders, that we were very purposeful in involving the healthcare district, recognizing that the healthcare district was the premier organization for the Coachella Valley in terms of resources and the purpose for why it existed. Yeah, there's been a lot of projects through the years that I'm very proud that we've been able to create and to further along.
So you were very familiar with the district. You were attending meetings. They were collaborating on projects.
Yeah.
So when it came time to, or when you were appointed, was there any hesitation, or you were just ready to go?
I attended a meeting. I remember that meeting. It was an evening meeting, and I came for another item on the agenda, and really I think it had to do with the expansion. And they were asking for input and trying to gain support for it, the expansion towards the Eastern Coachella Valley. So I came for that. And when I attended the meeting, I understood a little bit about it, but it wasn't until after the meeting that I went home and I started thinking, there's going to be 2 positions that are going to be available. And I can think of some really interesting people that would be very qualified. And as I started thinking about that and thinking I'm going to reach out and see if so-and-so is interested, I thought, what about me doing it? At that time, it wasn't my reason for actually attending the meeting. It wasn't until afterwards when the next morning I woke up and I mentioned it to my husband. I said, hey, I was at this meeting last night, and what do you think about me submitting my name for consideration? And he right away said, yeah, I think you'd be great. And I thought, well, who knows? Maybe they won't even pick me. But if they do, at least I'll be among other candidates and I'll be able to see if it works out or not. But if I don't submit, I won't know. So I did, and so it was, I think, very nerve-wracking experience. At first, his support helped me to say, yeah, I should do this. And so that's how it happened.
So here you are, 7 years later.
Yeah, 7 years later.
With your constituents in mind, Zone 7, how are you feeling about the process of our strategic plan development? And for our listeners, I just want to say that since August of 2025, we've been working with these wonderful consultants, SOAN, on developing a new 5-year strategic plan that's going to inform what we fund, how we fund, what we support in general. What has been your experience with that process?
So we have had several community meetings, and I have been pleased by, first of all, the great work that the team has done. I'm not just saying this because you're facing me here, but because the team has done a tremendous job in getting the word out and finding locations that are accessible to the public, scheduling them in times that will be varying so that people that are working can attend the evening, people that prefer the daytime, even on the weekend. That has been a tremendous work on the part of our team. And the people that have attended, every one of the community sessions has been well attended. There were a couple of them that I was a little bit worried about when I saw, okay, it's almost time to start and people aren't showing up. And all of a sudden, there will be people showing up. So there was definitely, I was really pleased by that it has been a good response. It taught me a lot. There were some themes that were reoccurring, but they were presented in different ways, but different experiences that were being brought up. But there were some things that were brought up only one time, that it was still important for us to learn those things. So there was that whole experience. I definitely think that it was worthwhile to be able to help us, each of the directors and the staff, to be able to get that kind of response and that kind of input into the strategic plan. And just moving forward, I think it's going to be a challenge to be able to take every idea and every want and every need into it. But SOEN has been an excellent facilitator. They have created a process that helps us to be able to assess the big picture and the little details. And I think that it's going to be a good strategic plan that we'll be able to present to the public in the month of May. I think it's a lot. It's definitely a lot to be able to sink in and to absorb, but I think it's something that we don't expect everybody to get into, because even I have been part of this process the whole time. There's things that I'm reminded of. Oh, we didn't agree to that. Oh, we agreed to that. So it's a lot, but I think that we have a good starting point, a good plan, and I'm looking forward to seeing how this is received by the public, and excited about having it implemented so that we could get going, because I know that the team, the staff, is getting nervous about, when do we start? Do we have enough people? Do we have enough resources? What are we going to prioritize? So I think there's a little bit of nervousness, but once when we get ready to say, okay, this is the start date, and this is the plan, this is how we're going to proceed, I think everything's going to fall into place.
I'm very optimistic. Like
Good.
you said, with any change, I think there is some nervousness, but I'm thinking it's going to be really positive.
Good. That's good.
I guess you've already addressed this, but I'm wondering what most concerns you about the future of healthcare in the Coachella Valley.
Even though we have a great deal of resources that we are going to be putting into play, that we're going to now have the revenue that's generated from the lease, the sale of the hospital, the first $100 million that's going to be coming to the district next year in 2027. Even though that influx of resources is coming our way, there's never enough resources. We have tremendous needs throughout our Coachella Valley. There are certain areas that are more remote, that are harder to serve populations, to reach the populations. What concerns me is, how do we ensure that there is enough resources for the highest needed populations, the most disadvantaged? I want to make sure that we continue to figure out how to do that. Even though I think we have a good plan, and it is definitely in there, it's a big part of it, but it is going to be hard because there's just not enough resources.
Right.
There's a lot of needs, and that's what is probably the challenge, is the resources that we do have coming in the future, the ones that we do have that will continue on, just to ensure that we are making the best decisions strategically on how to improve. Probably that's the thing. The key thing is, how do we improve the healthcare system? How do we become more proactive? How do we ensure that we are taking into account the most disadvantaged, the harder to reach populations?
Underserved,
But the underserved population. But how do we do that proactively? How do we do that in a way that is going to improve conditions for these families, but looking at impactful strategic funding that will be trying to address many of these conditions that they're facing, the chronic illnesses that they're facing, how do we address them proactively so that we are not waiting until people are so sick that it's not possible to help them. So being proactive, strategic, I think is what I need. I am worried about the resources. How do we use them in that fashion?
Those are really great points. So in addition to the money, it sounds like it's going to take a lot of collaboration with community partners to really make things happen and make sure that everyone gets the access to health and wellness.
That's correct. In that when you don't have enough resources, a way that you are working on it smarter is by creating these relationships with others that there's a lot of interest from public, like the county of Riverside, other foundations, other entities that want to collaborate. And so that we work together on funding some key initiatives that would be able to stretch our dollars even further.
We have such a robust nonprofit community. You in your position with RAP and with the healthcare district probably know that better than anyone. How would you rank the significance of our nonprofit community, if that makes sense?
Since you say that my current role, my daytime role, I would have to say way at the top because I believe that the nonprofit community serves such an important role in serving the public, the gaps that are not being served by the public entities. They know the community better. They're able to be more flexible. They're able to be more creative and and they're trusted by the residents. I think their role is definitely very high in improving the quality of life for residents and being able to provide that service that the healthcare district would be very fortunate to have them be partners in providing those services.
All right. So all of you nonprofits out there that we're already not working with, then please reach out to us. We want to collaborate and create new partnerships. Any last words for our listeners about the district, the future of the district, or just anything you want to share?
My experience with the healthcare district has been rewarding because it gives me an opportunity to be able to learn, but also to provide input on the perspective of families that I believe do not have the voice. That I know from firsthand experience that many times families do not feel like if they are being taken into account when decisions are made. And so I believe that is my role, is to be an advocate, to be the voice for families like myself and my own family growing up and families that are going through similar situations today. So that experience has been very rewarding, very humbling that I was reelected in this last time around. I'm very fortunate to have some fellow board members that I believe that all of us have one thing in common, and that we all want to serve our community. We all want to make a positive difference in the lives of the people that live here in the Coachella Valley. I love working with them, learning from them, and then learning from the staff also, because I believe that all of them have the motivation, the desire to serve people.
Very good. Director De Lara, thank you so much for being a part of the podcast.
Thank you, Will.
For those of you listening who want to learn more about the organizations we've mentioned, you can go online to learn about the RAP Foundation at rapfoundation.org. InnerCare is InnerCare, INNERCARE.org. And of course, the Desert Healthcare District and Foundation is DHCD.org. That's our show. Be well, everyone.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.